Hi, this is just a second video because I've been looking into some um jaw surgery vlogs and blogs, and I realized that there are certain things that I didn't really go too much into detail about. And that's because it didn't cross my mind to do it, and now I'm gonna do it. So basically, one, was I being wired shut after surgery? I wasn't. And the elastics, I just had elastics, and that was it. I also didn't have a plastic wafer, or I think it might be the same thing as a plastic splint. um why did I not have it? I don't know, but my orthodontist told me, Gillian, you need to come back to me after the surgeon, who is her student, takes off the plastic wafer. And I told my surgeon, I was like, okay, you need to know when. You need to know um when to tell me to go back to the orthodontist because I don't know. And he was like, and I told him, I'm like, the orthodontist said that it's when you take off the plastic thingy off me, but I don't know what it is. And he was like, okay, it's a plastic wafer. I didn't put it in you because technology now allows for not needing that, and also allows for you not being required to be wired shut. So he did tell me I can go to my orthodontist this week, and I'm going to her this Friday. But of course, I don't think I'm supposed to tell her that don't actually have, I didn't actually have a plastic wafer in my mouth throughout the whole post-surgery process. And what else did I want to say? Why did I continue having elastics? Actually, I could have taken off the elastics when I was in the hospital about 4 days after surgery, but I realized that when I slept, like when I sleep, the muscles in my jaw aren't completely grown or developed, however we want to put it, because during the surgery your muscles are sort of stripped off you to move your jaw and stuff like that. And I couldn't close my mouth without the elastics helping me. So it's sort of like a crutch, if you will. I think I might have mentioned that before, but anyway, I'll just say it again. And yeah, sorry, I know you guys are getting dizzy, but I am really uncomfortable in this position. Anyway, yeah, so that's all I wanted to add. Um, when I went back to my surgeon, he changed the elastics to one side being tighter. I've forgotten why, but it's just for a more stable bite, because right now one side of my bite is an open bite, like the jaws, the teeth are not meeting together, and that's because the orthodontist hasn't done her part to readjust the teeth in its new position yet. And like I said, human estimation of the mold pre-surgery and post-surgery can be quite inaccurate due to, it's just human error basically. And things that require high precision, such as your teeth and the gap between it requires some post-op work to be done. That's why before that happens, I'll need some assistance, like using elastics. That's all I have to say right now, and I'll talk to you guys tomorrow. If hopefully more swelling would have went down. I do think that the swelling quite a lot actually hasn't went down comparing to like right after surgery. I think I'm recovering quite well. I'm still hearing clicking, which is really irritating, but since my surgeon doesn't feel that as a problem, I'm gonna just try and be calm and cool about it. So yeah, ciao.